My name is Susan. I live in Central Virginia with my husband, who I've been married to for 31 years, happily married. We have 4 grown children, and it's a fun stage of life. I am 2 years into this diagnosis, and I'm here to share my story of polycythemia vera. I have been a nurse for almost 40 years, so I know a certain amount about, the medical and nursing world, but this diagnosis has certainly opened up a whole new level of information for me. So I was living my life, going to work and doing all the activities I normally do, and about a month before my diagnosis, I started noticing some left chest pressure that was very unusual. About a month later, went in for my normal annual physical, and my PCP found that my spleen was double the normal size, and rattled off in quick succession 3 things that I needed to get done, and quickly, and that was a CAT scan and a bone marrow aspiration, and to make an appointment with the hematologist oncologist. I was pretty surprised by all that. I didn't take that news very well. I immediately, like any normal human, looked into what was my life expectancy, and that was soul-crushing for me. So I was in shock to get the diagnosis, and until I was able to start gathering information to support how I was going to live out my life, as far as the quality of life and what I could do and what I could not do. So I was very, very scared. I was scared of a blood clot. So my hematologist oncologist offered to put me on a chemotherapy drug called hydroxyurea. I wanted other options outside of the chemotherapy. I wasn't comfortable going on chemotherapy because I felt I was really healthy at 61, and something told me there was something else for me. So I dove into the research on other options for polycythemia vera and found that there was another option, and it was in interferons, and brought that information, it was evidence-based materials, to my hematologist oncologist. I was over the age of 60, and he was not comfortable treating me with interferons at that age, and that if I wanted to get a second opinion with one of his colleagues 30 miles down the road that had more of an interest in MPNs, I could certainly do so. When we went to that appointment, we had our file folder of all the evidence-based materials on interferon treatment. So he drew out an elaborate, explanation of how the interferons worked with PV, and drew it right there on the exam table, put us at ease. And we were waiting for our cue, can we do this? And he said, why would we not do this? Why would we not put you on interferon? The hematologist oncologist hugged us each and said, we're going to be your partner in this journey, and we'll hold your hand step by step.
Important safety information. What is the most important information I should know about BESREMi? BESREMi can cause serious side effects that may cause death or may worsen certain serious diseases that you may already have. Tell your healthcare provider right away if you have any serious side effects during treatment with BESREMi. If symptoms get worse or become severe and continue, your healthcare provider may tell you to stop taking BESREMi. These symptoms may go away in some people after they stop taking BESREMi.
So once my MPN specialist prescribed BESREMi for me, the pharmacist set everything up and told me that it would arrive at my doorstep. So I had a lot of touch points, and I've been taking it for approximately 15 months. And right about the 13-month mark, I went in for lab work at the cancer center. My MPN specialist and I were both pleasantly surprised that my hematocrit was down to 38. My white blood cell count was now within normal limit. My platelets were also within normal limits. So there was a bit of a celebration in the office that day because, as a patient, you live in a certain amount of fear and you're not sure you're ever going to see, those numbers again. I did experience influenza-like side effects. They mostly came in the evening time. I also had a lot of musculoskeletal aches and pains, and after 13 months I came out the other side and I'm not experiencing any of those side effects. So I would have really appreciated being educated on the range of possibility of side effects, and knowing that everyone is very individualized. I really encourage you to reach out to your MPN specialist to gather some of that information and any resources that are out there. Knowing what I know now about the side effects and that they lasted only 13 months for me, I would absolutely choose BESREMi again. I'm feeling more confident and strong and starting to share my story, and I feel confident that I have a strong treatment plan. In the end, I'm more comfortable in sharing that with others.
Important safety information continued. What is the most important information I should know about BESREMi? Continued. Mental health problems, including suicide. BESREMi may cause you to develop mood or behavior problems that may get worse during treatment with BESREMi or after your last dose, including irritability, getting upset easily, restlessness and agitation, confusion, depression, feeling low, feeling bad about yourself or feeling hopeless, unusually grand ideas, acting aggressive, acting impulsively, or thoughts of hurting yourself or others, or thoughts of suicide. If you develop any of these symptoms, you, your caregiver, or family member should call your healthcare provider immediately. Your healthcare provider should carefully monitor you during treatment with BESREMi. New or worsening autoimmune problems. BESREMi may cause autoimmune problems, a condition where the body's immune cells attack other cells or organs in the body, including thyroid problems, increased blood sugar, hyperglycemia, and type 1 diabetes. In some people who already have an autoimmune problem, it may get worse during your treatment with BESREMi. Tell your healthcare provider if you have tiredness, are urinating often, or if you are very thirsty. Heart problems. BESREMi may cause heart problems, including problems with your heart muscle, cardiomyopathy, heart attack, abnormal heart rhythm, atrial fibrillation, and decreased blood flow to your heart. You should not use BESREMi if you have high blood pressure that is not controlled, congestive heart failure, a serious abnormal heart rhythm, narrowing of the arteries to your heart, certain types of chest pain, angina, or a recent stroke or heart attack. If you have a heart problem before you start using BESREMi, your healthcare provider should monitor you closely during treatment with BESREMi. Who should not use BESREMi? Do not use BESREMi if you have or had severe mental health problems, especially severe depression, thoughts of suicide, or attempted suicide. Have or had a serious or untreated autoimmune disease. Have had a serious allergic reaction to another interferon product or to any of the ingredients in BESREMi. Symptoms of a serious allergic reaction may include itching, swelling of your face, tongue, throat, trouble breathing, feeling dizzy or faint, and chest pain. Have certain types of liver problems. Have received a transplant and take immunosuppressive medicines. Before using BESREMi, tell your healthcare provider about all of your medical conditions, including if you are being treated for a mental illness or had treatment in the past for any mental illness, including depression, and have had thoughts of hurting yourself or others. Have type 1 diabetes. Have or ever had any problems with your heart, including heart attack or high blood pressure. Have or ever had bleeding problems, a blood clot, or low blood cell counts. Have a condition that suppresses your immune system, such as certain cancers. Have hepatitis B or HIV infection. Have kidney or liver problems. Are pregnant or plan to become pregnant. BESREMi may harm your unborn baby and may cause loss of your pregnancy, miscarriage. Before you start using BESREMi, your healthcare provider should do a pregnancy test. You should use effective birth control during treatment and for at least 8 weeks after your final dose of BESREMi. Talk to your healthcare provider about birth control choices for you during treatment with BESREMi. BESREMi can affect your menstrual cycles and may cause your menstrual periods to stop. Tell your healthcare provider if you become pregnant during treatment with BESREMi. Are breastfeeding or plan to breastfeed. It is not known if BESREMi passes into your breast milk. You should not breastfeed during treatment and for 8 weeks after your final dose of BESREMi. What are the possible side effects of BESREMi? BESREMi can cause serious side effects including decreased blood cell counts. Your healthcare provider should check your blood cell counts before you start and during treatment with BESREMi. If your blood cell counts are too low, you can develop anemia, infections, or have problems with bleeding or bruising. Call your healthcare provider right away if you develop weakness and tiredness, bruising easily, nose bleeds often, fever, chills, burning and painful urination, urinating often, or coughing up yellow or pink mucus, phlegm. Serious allergic reactions and skin reactions. Get medical help right away if you get any of the following symptoms: skin rash or hives, itching, swelling of the face, eyes, lips, tongue, or throat, trouble breathing, chest pain, or feeling faint. Eye problems. BESREMi can cause severe eye problems with your retinas that can lead to vision loss or blindness. You should have an eye exam before and during treatment with BESREMi if you have diabetes or high blood pressure and also have retinal problems. Your healthcare provider may stop BESREMi if you develop new or worse eye problems during treatment with BESREMi. Liver problems. BESREMi can cause increases in liver enzymes and liver damage. Your healthcare provider should do blood tests to monitor your liver enzymes and liver function before you start and during treatment with BESREMi. Kidney problems. Your healthcare provider will do blood tests to check your kidney function before starting and during treatment with BESREMi. Tell your healthcare provider right away if you develop any symptoms of a kidney problem, including changes in the amount or color of your urine, blood in your urine, swelling in your ankles, or loss of appetite. Your healthcare provider may stop BESREMi if you develop severe kidney problems. Tooth and gum periodontal problems. BESREMi can cause tooth and gum problems, which can lead to tooth loss. BESREMi can also cause problems with dry mouth that can damage your teeth and the lining of the mouth during long-term treatment with BESREMi. It is important for you to brush your teeth well 2 times each day and have regular dental examinations during treatment with BESREMi. Skin problems. BESREMi can cause skin problems. Signs and symptoms of a skin problem with BESREMi include itching, hair loss, rash, redness, psoriasis, acne, thickening of the skin, or excessive sweating. Call your healthcare provider if you develop a rash that is bothersome or covers a large skin area. The most common side effects of BESREMi include flu-like symptoms including tiredness, weakness, fever, chills, muscle aches, and joint pain, itching, sore throat. What is BESREMi? BESREMi is a prescription medicine that is used to treat adults with Polycythemia vera. Please see full prescribing information, including boxed warning and medication guide for BESREMi.